Everyone good? Well, good morning, Queensland. We're coming to you live today from the Redcliffe Kite Fest in beautiful Moreton Bay, where the Health Minister and I both live, and it's a beautiful day here down by the water. I know the last 24 hours Queenslanders have had their fingers and toes crossed, and it's fantastic to bring news that we can breathe a sigh of relief. There's no new cases in Queensland in the last 24 hours. We certainly, this is the best result we could have hoped for. Another donut day. I think the Health Minister's just bought us a couple of donuts to celebrate what is a great result, and is a credit to how Queenslanders do as we ask them to do. They wear their masks, they scan their QR codes, they socially distance. You can see all of that happening here at the Kite Festival, and that's what's stood us in such great stead. Of course, people have continued to get tested. We're not out of the woods yet. We do need to continue to monitor the situation, particularly south of the river down through Logan and into the Gold Coast. But this is the best result we could have hoped for at this point of the outbreak.
Thank you very much, Deputy Premier. Yes, a big sigh of relief, but we're not there yet. Thank you to every single person who came out and got tested yesterday, over 12,000. Thank you to every single person who keeps wearing their mask. That's genuinely what's keeping Queensland safe. So we didn't get any new cases yesterday. We did get confirmation that 2 of those 3 gentlemen who crossed the border from New South Wales into Queensland, and then one of them went and stayed with this family who's then tested positive. We did get confirmation yesterday that 2 of those 3 have tested positive. So I'm now confident that's where the virus came into Queensland to infect those 5 people. But those 2 people had minimal exposure in Queensland, so they had not been around and about, so that is good news. They had been down in the Gold Coast, so I would ask that anyone in the Gold Coast, any symptoms at all, no matter how mild, please come forward and get tested, and that everyone, anywhere, with any symptoms, come forward and get tested. I do thank that family, that mother of the 13-year-old girl, for coming forward so quickly to get tested, because it meant we could immediately get that school into quarantine before there was any spread. And I thank those 1,000 families who now are in quarantine at home for 14 days. That is really tough on them. I fully understand that, and I thank them very, very much for doing that. And we'll continue to work with those families, continue to test them, but given that they're now in quarantine, that risk is less. Now, we have had a few other notifications that I need to let people know about. So there's been a miner who works in West Africa who returned home from West Africa and went home to Charters Towers and Townsville and tested positive, but I'm very, very confident that's a historical case. So we'll do some more investigations there, but I'm not concerned. He was getting tested again on his way out of the country to go back to West Africa and tested positive, but he had been in quarantine in Sydney and had tested negative there, then went home and has subsequently tested positive. So I think that's some persistent shedding. I'm not concerned about it, but it's important that we work that through. Then also New South Wales has notified us of another positive truck driver who has been in the Queensland community while infectious. So I'll just check those double. So that was on the 7th and 8th of September that this truck driver came into Queensland while infectious and travelled through Brisbane. So we'll just be checking any exposure venues from that truck driver. It's really, really important though. We're seeing these continual incursions, but if everyone does what they've been doing, we'll work through this. So it really and truly is get tested with even the most minor of symptoms. We just don't know where in the state this might happen, so please, throughout the state, it's really important, get tested and wear masks. So unless you can genuinely socially distance when you're outside, wear a mask, and inside, in all venues, just wear a mask unless you're seated and eating and drinking. And if we just do that, we won't need to do it for too much longer, because soon we'll have everyone vaccinated. So please keep coming forward and getting vaccinated. Every single day we're seeing more people get vaccinated, and that's fantastic. And the sooner we've got the vast majority of Queenslanders from 12 years of age and older vaccinated, we'll be able to remove the restrictions. So thank you very much.
So it's wonderful to be talking to you from the Redcliffe Kite Fest. An event like this could not be held in any other state or territory on the east coast mainland of Australia right now. We are the only state open across the east coast, and we can hold events like this because Queenslanders have done the right thing. They've done what we've asked of them. They've come out and got tested whenever they've had symptoms. They've been wearing masks and they're getting vaccinated. We say thank you. To all those families who are now gone back into quarantine because of the most recent cluster, we say thank you for the sacrifice you're making, and we will do everything to support these families associated with the school and other close contacts, because we know how important it is that they quarantine to keep everyone safe. It is great news that it's a double donut day. I have just bought a couple of donuts here at the Kite Fest to enjoy. We had great results yesterday, and I just want to talk about our amazing testing results for a Saturday. We had 18,069 vaccinations yesterday and 12,415 tests. So thank you for over 18,000 people coming forward to get vaccinated. That is a great result. We're hoping for another big day today. In fact, we're trialling vaccination at the NRL game at Rockhampton today. So let's see how many footy fans come forward and get vaccinated. Today also we're announcing that we are mandating vaccinations for all of our health workers that work in our hospitals and all of our Queensland Ambulance Service staff. Now, already our health workers have done a tremendous job coming forward and getting vaccinated. In fact, 80% of our entire health workforce, so admin, our clerical, our security, our cleaners, our nurses, our doctors, have already had one dose, and 73% of our entire workforce is fully vaccinated, 73%. Across our COVID hospitals, 79% are already fully vaccinated and 84% have had one dose. But we know we need to go even further. So from today, we are mandating it, and everyone will have to have had their first dose by the end of this month, 30th September, and be fully vaccinated by the end of October. Now, I know that's only 3 weeks away to ensure everyone's had their first dose, but we're confident we can get there because the majority of our workforce is already vaccinated. We've worked with the unions. We have support across the board. We will work with those staff who cannot or will not get vaccinated to find alternative arrangements and work through those arrangements with them. But it is important that we keep our health staff safe, and of course it's important that we keep our community safe and those patients and visitors who come into our hospitals. We have seen a lot of transmission of the virus in hospitals through New South Wales, and sadly we have seen a lot of deaths associated with those hospital transmissions. So we do need to make sure that we're doing everything we can to lower the risk. Again, it's wonderful to be here. I want to acknowledge the Moreton Bay Region Industry and Tourism who put this incredible event on today. We're expecting around 15,000 people, and as I say, we are the only state on the east coast of Australia that can actually put an event like this on, and it's thanks to Queenslanders. So thank you so much for the great work you're doing. Come out and get tested, particularly if you're in south side of Brisbane, Logan area, or the Gold Coast. Come forward and get tested if you have any symptoms whatsoever, and keep coming out and getting vaccinated, and don't forget to take your mask everywhere you go. Thank you.
Minister, just on the mandating the jab, why so late, and now will those health workers, I think There was reports this morning around roughly 13,500 still waiting to get the jab. Will they now jump the line, Minister, or will we be able to do that work?
They've always been prioritised. We will absolutely make sure they can get vaccinated at work. We have always done that. There's a range of reasons why some people haven't. It may be that they've been on leave. We've got some staff that due to other health reasons or pregnancy, they've been a bit hesitant and they want to wait. We will work through that. Of course, there's conscientious objectors as well. So we've worked closely with the unions about what the alternatives may be, and we will make sure that we've got the health staff we need. I don't think we've been late to the table. In fact, we have the highest vaccination rates across health workforce across the country that I'm aware of, and it was because we were already talking about it that other jurisdictions like New South Wales started to move on this. But we've done such a good job of getting our staff to come out voluntarily to get vaccinated at such high rates, well over 80%, that we're very confident that those small percentages that left will be able to meet that. So there's a range of options. What we're talking to them about, they may be redeployed to elsewhere in different roles. Some So we will work with them as to the risk level, what their roles are. Can I say that we've already got, when it comes to clinical professionals, our doctors, 90 to 100%. So some of our COVID hospitals, 100% already in our doctors. So those who are most in contact with patients are already highly vaccinated. It's really just a small number, some in the clerical admin, some of our nurses as well. So we're working with them. For some of them, because they're in really critical roles, they will be just required to undertake further testing and another level of PPE, depending on where they're working in the hospital, to keep them safe and keep the patients safe.
Are you concerned about union movement, Minister, or they're on board with their members?
We have been engaging with the unions all along, and we have their support to make this announcement today.
So how do you sort of categorise who's, eligible for this kind of PPE sort of version or increased testing as opposed to someone who they know you can't work?
Yeah, so what we've worked through with the unions and with the executive management at every hospital is that they will look at each individual case and look at the circumstances relating that case. So it won't be a blanket approach. It'll be looking at any person who comes forward and says, I can't or I don't want to get vaccinated at this point in time. We will look at what role they perform, where they work in the health system, and what arrangements will suit them best. What is most important is we will make sure that we have the staff that we need to provide the service to the public. So the public should be no concern whatsoever that we won't have adequate health workers there in our hospitals to provide the important role.
Minister, do you foresee job losses? Will people be told, look, you don't have a job here now?
If an individual feels so strongly that they do not want to work in an environment that they have to be vaccinated, that is a choice for them. But I hope that we can come to arrangements with every one of our staff to ensure that they can continue to support the health system and that we can keep them and the community safe. I really want the staff to work with us on this. As I say, we've got 89% already in our COVID hospitals and over 80% in all of our hospitals. So I'm confident we'll get there and we will work very closely with them. But we've seen too many deaths and too many infections in New South Wales to not do this. And we have seen thousands and thousands of health workers lose their lives because of COVID around the world. And I just don't want to take that risk with our staff.
Would you consider extending the period of time that health staff is aged there have to get vaccinated to the 16th of September?
Okay, so it is National Cabinet and the Commonwealth that has decided that time frame. We would not be inclined to go it alone and change that. It really would have to be a decision of the Commonwealth and National Cabinet to shift that time frame. I will say this, I'm very confident we will meet the aged care vaccination requirement for our publicly run aged care facilities. I am concerned about the private sector. I've been asking the Commonwealth what is their contingency plan if the private aged care sector cannot meet these targets by this deadline. I haven't seen the detail of that plan yet, The Commonwealth have said this is their responsibility, the implementation of vaccinating the private sector, and it is up to them to develop the plan, but they haven't enlightened us what that plan is, and I'm very concerned because that deadline is coming, and we can't afford for any aged care centre or facility to not have adequate staffing.
Sorry, Minister, that 13,500 news box reporting this morning, is that, to your knowledge, is accurate to that number?
Look, it's a maximum number. So the number we've got is what we've been able to identify through our own records and through the Australian Immunisation Register. There may very well be others who have gone off to GPs, community pharmacies that aren't in the system yet. And I won't be surprised, I've been talking to people all day at the Kite Fest yesterday, and so many have already got bookings or have recently been vaccinated with pharmacies or GPs. So there's probably other people in the system.
And we've got enough for them?
Absolutely.
Are we not sort of creating a two-tier system where, doctors who might be in a critical role, they're let off essentially to have a vaccine potentially if they have a objection, but the cleaner, might be showing the door? I mean, is that not a little bit unjust?
Well, again, I'm not saying that the cleaner will be shown the door, because we will look at the risk where they work and whether we can overcome that risk through other measures that still allows them to do their job but requires an added level of protection, which might require testing every single day, and extra levels of PPE and so forth. So I'm confident we'll work with this. But can we say doctors won't be let off? They don't need to be let off. The figures I have across our hospitals is our doctors have absolutely rocked this. They are at the top of the list as to who has been vaccinated in our health system. In many of our hospitals, 100% the doctors are vaccinated. So,
Last question now.
Dr. Young, with the, if you could just get some clarification. Off the top, you said 2 of the 3 people that have come across, provided they're essential workers, is there any sort of more background as to what they were doing here in Queensland?
That's been looked into, but I understand they followed all the appropriate protocols. There were 3 who came across, and 1 is tested negative and is now in quarantine with their family, and the other 2 are positive and are back in New South Wales.
Friends with that young 13-year-old, is that right?
No, one of them stayed in the house where the father lives.
Where'd the other one go?
He went elsewhere. That's why I was saying that people who live in the Gold Coast, not that I'm particularly concerned, but he did go to other places. So the message out of this is I think that there's been minimal exposure from those 2 people, but people just need to be cautious. We know that the person who did infect the 13-year-old girl had very little contact.
Very last one.
They came across the border with appropriate passes, I understand. The police are looking at that, but I understand that everything was followed, but there's further work being done by police. It's too early to say that, but I sincerely hope that we have, and it's because Queenslanders have just done everything right yet again. Queenslanders have come and got tested. This family has been absolutely fantastic. We've got a school closed because if you remember in previous outbreaks, the school kids had a weekend while they were infectious out in the community, and that caused all of the issues, whereas this time we've got to the school while they were only during the school week, so we've managed to quarantine those 1,000 families. So this is quite a different situation to previous outbreaks. I don't know that we can say we've dodged it yet, but I'm hopeful. I'm genuinely hopeful.
How they actually, what path they had, because I think people are quite interested.
Police are looking at that, so I would suggest that you ask police.
But people will be quite interested in how.
Of course they will be, and police will deal with that. I'm not aware. I'm aware of these people crossing the border, the date they crossed, and where they've been in our community and when they went back. The issues about what border pass sit with police, and police are managing that. Yes, they crossed on the 5th, and they were only here for 2 days. The one person in that group of 3 was fully vaccinated 2 doses, and they've tested negative. I'm very happy with our testing rates. I thank every single Queenslander who comes out. It's not a pleasant test, I know that, and sometimes there are queues, but we're doing our absolute best to minimise the queues, and we're also doing our absolute best to get results back as quickly as we can, because I know people are inconvenienced because when they get tested they then have to wait until they get a negative result before they can go back about their lives. So I thank every single Queenslander who is getting tested. It's enormous numbers. Thank you very much. Oh, 12,000. No, we were sitting, when we didn't have outbreaks, at about 1,000 a day. 12,000 is excellent. Of course, I want to see more, but then if you don't have symptoms, you don't need to get tested. So this is symptomatic people. We're coming out of our, coughs and colds season in Queensland. We're coming into summer. We know there are less symptoms, less hay fever, etc. But those people who do have symptoms, no matter how mild, like this young girl had a headache, any mild symptoms, please come forward and get tested so we can find the first case in the outbreak.
Deputy Premier, touching on what Dr. Young said there, fantastic for Queensland today, being in that people from New South Wales have come over and it's being investigated. Is it a tad bit frustrating?
Well, look, obviously it's our border that's keeping us safe right now, and we need to do everything we can to make that border as strong as we can. And as Dr. Young has said, the police will investigate those circumstances. There are penalties if people are breaching the border restrictions. Right now, it's that border that is keeping us safe, and we need to keep it intact.
Are you aware of what passes they have?
I'm not aware, no, but as we say, police will investigate, and if appropriate action will be taken.
Why would the police not have briefed everyone here about what passes they have?
There's a level of detail that we can go into at this point in time. Police are still investigating, and no doubt we'll have more information over time.
I just asked about the LNP JobKeeper payments as well. What's the government's response to that?
Well, this is pretty hypocritical of David Crisafulli. He talks a big game on transparency, and then the first time he's asked to outline how taxpayer funds have been used by the LNP, he refuses to do so. So I'd simply urge him to take his own advice, be honest, be truthful, be accountable, and tell the public how much JobKeeper they took and what they spent it on. This is a leader who's refused to call on the Prime Minister to extend JobKeeper to our tourism and hospitality businesses in Cairns. Well, I'd say if he thinks it's good enough for the LNP to get that kind of financial support, why isn't it good enough for Cairns businesses?
Does Labor claim JobKeeper?
Labor in Queensland has not claimed JobKeeper.
Considering, I guess, the incursions that we've had, very few from New South Wales to Queensland, are you concerned that New South Wales the regional areas are out of lockdown and Sydney is about to get, a little taste of freedom? Does that concern you?
Look, we'll continue to monitor the situation there very closely. Obviously, the efforts of people, particularly in those northern New South Wales LGAs, have allowed us to increase movement between those border communities, and that relieves some of the pain of the border. But we want to keep these measures in place to avoid widespread outbreaks for as long as we possibly can, to keep the window open for people to get vaccinated, so that when it does arrive here, we can have as many people vaccinated as we possibly can.
Can I just ask lastly on this mandatory vaccination? Obviously the government's sort of powering ahead on public institutions. What's your advice to businesses out there who are sort of watching this unfold? What's your message to them? Should they be changing strategy?
Look, those kind of workplace rules are governed by the Commonwealth Government, and we'd urge them to provide more support and more direction to businesses as they make decisions about when it's appropriate to mandate vaccines.
Okay, thank you.
Thank you.
Thanks, everyone. We've got to get them donuts first. They might want to still off the donuts.